Hi, welcome to The Sacred Journey. The Sacred Journey is the program that reminds you that life is a wonderful adventure. Each and every experience we have is a unique and perfect opportunity for learning. I'm Joyce St. Germain, and I know you recognize Dr. Frank Aieta. You've seen him on many shows throughout the years, and I want to be sure to get this show title right. Taking Back Your Health with Dr. Aieta. Thank you for coming back, and
Great to
sounds
be here.
like simple words, Dr. Aieta, but such powerful and meaningful
Yeah.
statements. So the ball's in your court. You have so
Okay.
much to share.
Well, I think this show is going to be, I'm going to discuss a little bit about, I wrote a book a little while back, and the name of the book is called Taking Back Your Health through Individualized Wellness-Based Naturopathic Medicine. And so the whole premise behind writing this book was I found that, I see patients every day in my practice, and I very busy practice, and I can only see so many. And there's, I have patients that, that are waiting to come to see me and so forth. So I said, I'm going to write a book, not just for my existing patients, so that they can kind of look back at things that we've talked about. Because, I talk a lot when we visit, when patients come into my office. I go through a lot of different things, and a lot of it's lost. A lot of people forget it. There's very dense conversations. We talk about, we talk for hours, and some of the stuff is really important. And so I put it all down in a book. And not only did I write this book for my existing patients, but I wrote it for just anyone that's looking to kind of think outside the box when it comes to their health, kind of go above and beyond what their conventional doctor may just be doing for them. And when I talk about individualized medicine or wellness-based medicine, I like to contrast that to conventional medicine, which is typically a one-size-fits-all model, okay? More of a disease-based model, in fact. And when we say one size fits all, it's like, you go to your doctor, you go in with a group of complaints, some symptoms. They'll do some testing, they'll do what they have to do. And if they find that everything looks good, they say there's nothing wrong with you. You have no overt disease or pathology. But you say, well, I have this symptom. Well, they say, okay, well, we can't figure out what's causing it. So we're just going to give you a drug to mask that symptom. And most people are content with that, and they go on their way until the next little incident comes back, and they go back to their doctor and they look a little bit further again, and they look for anything crazy going on, any overt disease or pathology. If there's something there, then they will address it. But once again, if there's nothing there, then they will just address the symptom. Well, the problem with that is that a lot of times what I see in my practice, and a lot of times what other doctors see in their practice, these are when people present with symptoms with no overt disease or pathology behind it, these are what are called functional problems, meaning that they're symptoms directly related to dietary shortcomings, nutrient deficiencies, maybe some hormonal imbalances, maybe an underlying viral infection or bacterial infection, maybe a structural abnormality, something in that range, okay? And the problem with those types of issues is that conventional doctors don't really know how to address those. Your basic doctor has little to no training in nutrition or exercise science or anything like that. So they're not going to think about that. A patient could come in with an overt symptom that is related to, let's say, a nutrient deficiency. And because that doctor is not educated in proper nutrition, because you can talk to, and I ask patients that are watching this to ask their doctor, how many hours, how many years of training do they have in nutritional medicine? And they'll, unless they took some extra classes after they graduated, they're going to say pretty much zero. Okay. So, but if you ask them how many training they have in drugs and surgery and things like that, they're going to say, yeah, we were rooted in that. Okay. So when a patient comes into my office, that's the first thing that I do. Obviously, I look for overt disease or pathologies. Does this person have cancer? Do they have an autoimmune disease? Do they have something underlying that is problematic? Okay. And if I can't find it, let's say I suspect something is going on with someone's digestive tract. I may send someone to a specialist to get some imaging done, maybe a colonoscopy. They bring that information back. We go through, we do our due diligence. But the difference is that when the way I practice, I don't just stop there.
Right.
Okay, we don't stop right at that point. Go ahead.
A minute ago, you said that, if you were to ask a traditional doctor how much time
Training.
you study or training in traditional medicine, did you mean traditional medicine or nutrition or
nutritional medicine? I'm sorry.
I thought that's what you meant because
Yes.
I know you well enough. Okay.
Thank you. Yes. So if you ask any conventional doctor how many minutes or hours they have of training in nutritional medicine, I'm sorry.
No, that's okay. I knew you meant.
They'll say zero, or they'll say very little, or unless they took some type of course afterwards.
Yeah.
Okay.
Okay.
So when we talk about nutrition, we're talking about not just basic nutrition like RDA type of things. We're talking about nutrition to heal illness and cure diseases and so forth, just through diet, lifestyle, and nutrition. And so the big problem arises with conventional doctors is that when they lack that knowledge, everything that goes beyond that, they're going to just use a palliative type of treatment. They're just going to mask the symptoms. And I use the analogy of how conventional doctors address these things as you're driving down the street and you see a burning building, and instead of putting out the fire, you smash the fire alarm. The body is telling you there's something wrong. It may not be something severe like cancer or whatnot, but it could be something more functional. Your body's telling you, okay, we need to change something. We need to do something. I need something here. Help me out. And we can kind of Band-Aid or mask that symptom, or we can address the root cause. And so, yes.
Sorry about that. If we take a look at diet, many people are still using, people in their 50s and 60s, what they learned in high school. Here's the pyramid, here are the meals. Yes. And people are eating things that don't align with them, allergic, sensitive.
Sensitive, yeah.
Would you spend some time going on that? Because, as you know,
Sure.
as a naturopathic physician, food is medicine. And there's such a different approach than what we had been taught.
Well, I'm glad you asked that because that's a big part of it. So on almost every patient that I see in my practice, obviously we go through diet and lifestyle. I ask the person what they're eating breakfast, lunch, and dinner. In fact, when I send them away between their first and second visit, I have them do a little exercise for me. I have them pick 2 days during the week, 1 day on the weekend, and write down everything they're eating on those 3 days. And then what I have them do, I have them go one step further. I have them actually quantify the amount of carbohydrates, starches, and sugar they're consuming in their diet on a daily basis and bring that information back to me. So that way we can kind of almost individualize their diet based on a carbohydrate basis and so forth. But then we go one step further past that and we identify foods that their body may be sensitive to. So I would like to differentiate between a food allergy and a food sensitivity. So most people listening to this, most people out there are familiar with a food allergy. When we talk about food allergy, we talk about you put something in your mouth, you get immediate reaction. Think like a peanut allergy, okay?
Right.
Now, most people that
life-threatening.
Life-threatening or
life-threatening is what people know.
People know that, and then there's other types of allergies that may be a little downgraded, and it usually affects the skin, respiratory tract, or digestive tract. It's usually like a hives on your skin.
Okay.
They're not life-threatening. They're pretty annoying. You can get heartburn after eating something. You can get congested. So it's an immediate reaction. Now, most people already know these things. They already know, I can't eat peanuts, I'll end up in the hospital. I can't eat this, I get a hive. Okay. A food sensitivity is a whole different animal. A food sensitivity is more of a delayed or cumulative response to a food, meaning you eat something in the morning, feel perfectly fine, 4 or 5 hours later, the next day, 2 days later, you get a reaction. And it can affect anywhere in your body. It can affect your skin. It can affect your joints. It can affect how your brain is functioning. It can affect your mood, anything. So how does this happen? Okay, how does a food you eat in the morning affect you a day later? Well, it's all based upon your digestive tract. So let's talk about the digestive tracts. I think this is important. So digestion first starts in your mouth. Chomp away at the food, you're breaking it down. The whole goal of the digestive tract is to break food down to its smallest little parts. Proteins to amino acids, fats to fatty acids, and carbohydrates to glucose. And as it's working its way through your digestive tract over a period of hours and sometimes days, depending upon how slow or fast your digestive function is, when by the time all that stuff gets to the bottom of your small intestine, it should be broken down into its smallest little parts. And at the bottom of your small intestine, there's a very selective barrier that determines what should stay in the digestive tract and what can get transported into the bloodstream. Okay, so very selective. And ideally, only small little molecules should get into the blood. But in certain instances, that barrier can be a little leaky, can be a little broken down. And what causes that? It could be due to poor diet. It could be due to imbalance of bacteria. It could be due to medications and so forth, can thin that barrier out. Now, let's say you eat an egg for breakfast and 5 hours later, it's made its way through the digestive tract. And once it gets and so maybe there's some undigested egg proteins. Once it gets to the bottom of your small intestine, those proteins can slip through the cracks, get into the bloodstream, and your body sees that protein, that egg protein, as a foreign invader. Okay. That protein's not supposed to be in your blood. Okay. It's supposed to be broken down. So if your body sees it and says that's not supposed to be here, your body will mount an immune response against that protein. And that immune response can affect anywhere in your body. And
is that leaky gut, Doctor?
Yes, honey. It's
big
leaky gut. Yes.
Buzzword right now.
So that's a huge buzzword. And it's not that you have big holes in your gut. It's that the lining of your intestinal tract is a little thinned out and it's more or less leaky, where proteins and things and toxins and whatnot are going to get into your bloodstream kind of non-selectively. And then your body has to mount an immune response against it. And it's typically an inflammatory response. Your body will tag that protein, pull white blood cells and inflammatory mediators into the area to attack it. Okay. And so what ends up happening is that can turn into a systemic inflammatory condition. Like I said, can affect anywhere. And so what we do is we can run a test to check for this. It's called a food sensitivity test. And it's a very easy test. I do it on almost every patient in my practice. You prick their finger, you get 5 drops of blood, we mail it into a lab, and they evaluate your blood against 132 different foods and food additives. And it will also tell me in this test the integrity of that gut lining. How leaky is your gut? Okay, because if you have a really leaky gut, your body will be forming proteins and so forth that are getting broken down, and we can measure those in the blood. And so if we have this leaky gut type of situation, it can potentially get worse and worse and worse over time, leading to more and more problems. So I'll give you a quick example of a case in my practice, because I think using case studies is always very good. So I had a woman come to see me who works as a nurse. She works 3 days on, 4 days off. Okay. And so her 3 days at work, she's working the night shift and so forth. And she came in to see me and she says, I'm working 3 days a week. By the end of my 3rd shift, my hands are so swollen. They're so inflamed. I could barely use them. And she says, I have some digestive issues as well. And I don't know what's going on. So I said, let's run a food sensitivity test, see what comes back. So we run the test. She comes back to see me. Top of the list was coffee and gluten. Okay, so those were the 2 top ones. Gluten's the protein found in wheat. And so I said to her, I'm going to go out on a limb. You're working 3rd shift. How much coffee are you drinking? She starts laughing. She goes, I drink like a pot of coffee a night when I'm working. I said, oh my God. Okay, so first thing you're going to do is cut out the coffee. We're going to cut back on the gluten, and we're going to see how things go. I'll see you back in 6 weeks. Comes back in 6 weeks, cuts the coffee out of her diet. She goes, no pain whatsoever. My hands are perfect. She goes, and I can drink coffee. I said, you can? She goes, I just can't drink a pot of coffee a night. She goes, if I have a cup here or there, it's not so bad. If I overdo it, I start getting a little bit of inkling of pain, but nothing severe as I was getting previously. So that's how we can identify. So this is a really cool case. And I have hundreds of cases just like that. Within a short period of time, almost just a few days, the person may see a complete resolution of their symptoms, whether it's digestive symptoms, skin symptoms, joint symptoms, brain symptoms, whatever it may be, even energy. And so I find that this test is very, very crucial. And this is where we're talking about when we talk about individualized medicine. Because, you know, one person's food could be medicine, the other person, it could be poison, right? And so the only way to identify that, well, the best way to identify it is through using this particular test.
Now, did that indicate, the results of that indicate how allergic or how reactive or how sensitive she was?
Yes.
So you can have a little coffee, but no gluten.
Yeah, so it's at the top. So with her, it's quantified on a scale of 0 to 4, okay? What the reaction is in the test tube when they do it in the lab. So it just so happened that, you know, both of those foods were at the top of the list at a +4. So she stayed away from it staunchly for like a month. And then she started to creep it back in just to see what she could tolerate. And she said, if I overdo it, if I drink more than a cup, I start getting a little achy. So I know to stop. And then maybe the next day I won't do it. So I said, oh, that's perfect. That's the best way to kind of approach this. You know, it's a tolerance thing. A little bit won't hurt you. A little more will cause a problem. So her body can deal with those proteins in a small quantity, but when it becomes overwhelming, then the immune response gets too magnified.
So do you recommend for somebody like that they go on an anti-inflammatory diet, or just stay away from those things that are marked?
This would be more or less their anti-inflammatory diet. Because, you know, it could be, you know, you can do a generic anti-inflammatory diet, taking out the most common culprit foods, but then you may be taking foods out of someone's diet that they don't need to stay away from, or you may be missing certain ones that are not on an anti-inflammatory diet. Like
So
I ran this.
tried and true. Then this test is.
This test is.
I'm pointing here because, for.
There you go.
I want to see it in it. This isn't the ideal way to do it, but you can see it's pretty.
Yep, it quantifies it, and that's a graphical representation of all of the 132 different foods and food additives. And it gives you a level for which your body's reacting to it.
No reaction, mild reaction, moderate reaction, high reaction, severe reaction.
So if it's a higher severe reaction, I really try to keep those foods out of the person's diet 100%. If it's lower than that, I say, listen, rotate through it and observe your symptoms. So that's just one little piece of lab work that I'll run on every patient. And in my book, I also talk about what types of blood tests that I would recommend every physician run on their patient to get a true picture of their overall health. Not just running, let's say, a cholesterol level or a blood sugar level. We're looking at hormone levels. In particular, stress hormones, male and female hormones. We're looking at nutritional levels, vitamin D, vitamin B12, omega-3s. We're looking at all of the different nutrients. If the person's presenting with certain symptoms, let's say fatigue or whatnot, we will evaluate their thyroid gland. We'll also look at, you know, are they harboring any infections in their body, any viral infections, bacterial infections, and so forth. So when we run this very comprehensive blood work, we're leaving no stone unturned. And this is all conventional blood work that any doctor can run, not just a naturopathic physician. And by running this, we can really look and identify a lot of the functional etiologies behind illness, behind symptoms, we'll say. So a person can have a symptom that's related to a nutrient deficiency. And unless you're looking for that nutrient deficiency, it's out of sight, out of mind. You're just going to address the symptom. So a person could have numbness and tingling in their hands and feet, and your conventional doctor may work you up to make sure you don't have a pinched nerve, or you're not a diabetic and you're not having diabetic neuropathy, but they may fail to look for nutrients that may be contributing to that. Maybe a B12 deficiency, maybe a B6 deficiency. And if they do not look for that, what ends up happening is the treatment becomes just palliative, meaning it's just addressing the symptom and not addressing the root cause. Driving by the burning building instead of putting out the fire, so that's the whole thing. And so when we look at it from that perspective, it's like we got to dig deeper. And I think that's what people are looking for. And that's what prompted me to write the book, because most of the patients that I see, they say, I went to my conventional doctor. He had no clue about this symptom. So he sent me to this guy, this guy, this guy. And then they show up at my door and I say, this is easy. It's due to this, because I just ran blood work on you and I looked outside the box.
So this blood work is different and more comprehensive than those scratch tests that an allergist would do.
Okay, so let's talk about that. So the scratch test is looking for immediate sensitivity reaction, immediate allergic reactions, okay? It's not looking for delayed or cumulative responses like this sensitivity test, remember? So a scratch test is looking for, and that's not even a great way to test for foods, because you have a different immunity in your digestive tract than you do on your skin. So this is a better way of testing for environmental allergies, but when it comes to food, it's more of a hit or miss, and it's specific for immediate reaction allergies. If I want to know a person's immediate reaction allergy, I'll run a conventional blood test. It's called an IgE related blood test, and I can specify any type of foods and environmental things that I want. And I will run those on people. If, let's say, someone comes in and says, I'm getting hives and I don't know why. I say, okay, well, if you're getting hives, it's immediate reaction. You can't pinpoint the food. Well, give me a list of foods that you eat. We'll test you for them and we'll see if you have an immediate reaction to it. But if someone's saying, I get hives and it's like in the middle of the night, and I'm not eating or anything, or I wake up with hives, I'll say, okay, it could be due to what you were eating the day before. That's a sensitivity more. Okay, so that's when I'd be more inclined to run a food sensitivity test opposed to a food allergy test. And then there's one more thing that people get confused. There's a food intolerance. So a food intolerance, this term refers more to an inability to basically digest a certain type of food. Lactose intolerance, for example. A person with lactose intolerance, they may not have a dairy allergy or a dairy sensitivity, but they just have an intolerance where they can't break down the lactose found in dairy products. And what ends up happening is they may lack an enzyme that breaks down lactose, and that lactose molecule stays in a large form. And if there's any bacteria in your digestive tract, it'll start chomping away at that undigested lactose molecule and produce gas. So it's a different type of situation. So you can have a sensitivity, an allergy, or an intolerance. So I like to differentiate all of those when I work someone up. And a lot of times I can tell just by their presentation. An intolerance typically presents with more gastrointestinal symptoms: gas, bloating, heartburn, loose stools, constipation. Whereas a food allergy can affect the skin, respiratory tract, or digestive tract, and then a sensitivity anywhere in the body.
Okay, and in your book, you
Yes.
suggest that people kind of get a little educated before they go for their blood work. They
Yes.
become better informed. Can you address that a little bit? Nobody thinks there's prep work for a blood test other than fasting.
So the big thing is that, I wrote the book to kind of encourage people to kind of look through all of the testing that I typically will run and see which tests kind of jive with what's going on with them currently, because a lot of times their conventional doctor may not be looking at those types of things. Okay. So let's say someone has, they're gaining weight, they have dry skin, their eyes are a little dry, they're losing some hair. Your doctor may see these as individualized symptoms, but I may see those as all thyroid condition symptoms, okay? Low thyroid symptoms. So your conventional doctor may just pinpoint one individual symptom instead of looking at it as a complete picture, and they may miss it. So in my book, I kind of go through some of the symptomatology that is associated with certain lab tests. If this is low or high, you may present with these types of symptoms. So when people read through the book, they can say, okay, well, my doctor, I know he's going to run this test and this test and this test, and that's it. But maybe he's going to forget to run a B12 level or a vitamin D level, or, one of these other tests, or maybe my adrenal level, to see if that's a contributing factor to my fatigue or whatever it may be. So when a patient reads the book, or, before they go to their doctor, at least it will arm them with information that they can have a dialogue with their doctor regarding. Not saying that they're going to go in there and dictate to their doctor and try to be their own doctor, but they're going to go in there and have a dialogue with them and say, listen, I just read this book. What about testing for this or this? And if the doctor says, yes, fantastic, we'll run it, and they can interpret it. And if they don't interpret it correctly, that you can go to your book and you can interpret it yourself. Okay. And then I also talk about in the book, if your doctor is not willing to run that blood test, in the book, I discuss ways that you can run it yourself for pennies on the dollar. Okay. It's very, very inexpensive to run a lot of blood work, and you can pay for it out of pocket. And there's a couple different sites that I mention in the book where you can go and order your own blood testing, bring it back and look in the book and say, I think I have this going on or that going on. And then you can present it to your doctor if you want to, or you can take some of the steps that I talk about in the book to take back your health.
I was going to say, what a beautiful way to close the show, to remind people they can take back their health. And I have always known you to be not only a wonderful naturopathic physician, but an educator, both patient by patient and by doing this kind of work. So you already,
that's the only way you're going to keep people to be compliant too, is like, if you're just dictating to someone, it's easy to dictate, okay, take this pill every day. Okay, that's not too hard. But when you're dictating to a patient, you need to change this and do this and change your diet like this and that, you need some ammunition behind you to explain why you want them to do that. Otherwise, it becomes like, why am I doing this again? And do I really need to do this? So, and a lot of times to eliminate certain symptoms, they need to do these big changes for a period of time. It's not an immediate quick fix reaction. So if someone has a certain symptom going on and it's related to a nutrient deficiency or whatnot, it may not be instantaneous. It may take a little bit of time. So you want to keep them in the game and keep them doing it so that they can stay with it.
Okay, well, we'll have to end here, but thank you as always for coming and sharing your gifts and knowledge and wisdom with us. And you promised you'd come back another time, so we'll look forward to that. So thanks, Dr. Aieta, and thanks for joining us on the Sacred Journey. We'll catch you next time.
Thank you.
Sometimes life just happens. Don't worry. Farmington Motorsports will get you back on the road and at a fair price. From towing to tires, emissions to transmissions.
Our ASC certified techs do it all.
Farmington Motorsports is a family-run business. We're a Napa Auto Center and AAA approved. We work on all makes and models, from preventative maintenance to major repairs.
And every repair is backed by our 2-year, 24,000-mile nationwide warranty.
When life happens to you, don't worry. Farmington Motorsports.